Today, I am thrilled to introduce our guest, Dr. Sam DuFlo. She is an educator, a disruptor, an entrepreneur, a consultant, and a fabulous mom to boot. She brings a bold, no BS approach to perimenopause, mental health, and pelvic physical therapy. She's been reshaping the conversation around women's health with fierce advocacy and a passion for empowering every stage of the female experience. Welcome, Dr. Sam.
Thank you so much for the lovely intro, Kelly.
Oh, I wanted to start for some listeners who might not have as much information around pelvic floor health. And I know it's gained a lot of attention over the recent years, and you've been the pioneer in this, really. I wanted to get an idea of, can you briefly educate us, why exactly is pelvic floor so important to pay attention, mostly at this stage?
When we're talking about perimenopause and menopause, a lot of times folks don't understand the pelvic floor until an alarm bell rings. They're having pain or they're having some kind of symptoms. And so, as people are now educating themselves about a little bit more preventative health, to understand that the pelvic floor is a series of three different layers of muscles that form the base of your pelvis. They provide an access for sexual pleasure. They provide, and the pathways for that. There's sphincteric controls, so controlling your ability to urinate or control that, defecate or control that, obviously, where you're menstruating. And then they provide a lot of support of those organs. That's their main job, is to provide stability to your pelvis and support to your bladder, your uterus, and your rectum, which is most posterior. And I think it's really important because estrogen really participates in the health of these muscles, which then affects their function. So whether it's leaking, dryness, a little bit of thinning of tissues, there's so much that's involved in that core canister and the pelvic floor when it comes to, going through these different life phases as we age and maintaining good health.
Okay. And as estrogen's doing that lovely up and down flow, do they need a workout? Like, what does that look like?
That's a great question. The way I describe it is that if you imagine that these muscles, like this lush area of the vulvovaginal area, the anal rectal area, all of that together, if you imagine that that's a rainforest, and estrogen is what is keeping that leafy and green.
Oh, I like that.
Estrogen provides good blood flow, plump tissues, thickness, and like health and vitality of these tissues. Estrogen nurtures a lot of that. And when we start to get some hormonal depletion, you get thinning of those tissues, dryness of those tissues. It kind of approaches more of like a winter versus a leafy green rainforest. I'm not making fun of that. It's just a good visualization of like,
Yes.
There are many ways to keep your pelvic floor healthy.
Yeah.
Even if you don't have access to or cannot take hormone replacement therapy or topical hormones.
Yeah.
But it's about keeping the vitality of those muscles very robust, keeping them strong, keeping the blood flow going. And so how do we do that? We use them, whether that's maybe doing some Kegels or exercises in moderation, self-pleasure, participating in sexual intercourse or penetration, exercise, doing things like Pilates, yoga, a lot of like hip and core strengthening. And it's important to understand that although a person might be experiencing some estrogen and hormone depletion, that is not an automatic signal to just jump headfirst into doing 100 Kegels a day. That sometimes those tissues get thin and they can be painful, and you may have some weakness, but they're because they're too tight. And that's where pelvic floor therapists come in.
Well, funny you bring up the tightness, because I think there's so much around that from the mental health perspective as well. And we've talked about this offline about when we're stressed, we tighten up, we clench. And it wasn't until I met you, I realized this. I'm like, oh my gosh, So can you talk about specifically about Kegels? I think there's a lot of confusion around it.
Confusion, and I'm hoping we're leading towards a shift.
Yeah.
It's so if we were going to talk about your quads and we said like you need to do squats for your quads are a really big global muscle that's it's responsible for movement of big joints. You
Okay.
would not do 200 squats a day.
Mm.
However, when we're talking about Kegels, which is named after Dr. Kegel, I usually call them pelvic floor contractions because it's contracting the pelvic floor muscles. So when we're talking about Kegels or pelvic floor contractions, then that's a much smaller muscle body. And
Mm.
so would we do that 200 a day? No, that's counterintuitive. If we
Right.
can't even move a really big muscle that much, that little one, you know, every time you squeeze it, it needs time to relax. And so pelvic floor strengthening or Kegels is meant to strengthen muscles that are weak.
Yeah.
Sometimes weakness can be because things are too tight. So think about your biceps
Mhm.
muscle. We're looking at your biceps here, and
Yeah.
you come to me and you're like, I can't pick up a coffee cup. My hand's too weak, my biceps too weak. I wouldn't, if you were stuck here, I wouldn't say like do a million bicep curls because you wouldn't get stronger because you're just going through this motion right here. We need to get the muscle to lengthen all the way to contract all the way. And so for your listeners, I would think of like, think about gripping your hand tight into a fist. If you're
Mhm.
gripped like that, can
Yeah.
you grip more? No. So if your pelvic floor is really tight and clenched, you can't do more Kegels. However, so we need to get it to like relax and open first to contract. So when
Mm.
we talk about Kegels in this like grand generalization, and many people have been like, I read something and it said I should be doing 100 Kegels a day. And I ask like, why?
Yeah.
Like, why not 20? Why not 10? Why not 30? Like, what's the reason for that? And I think we really need to decipher, are you experiencing leaking, incontinence? Are you pain free?
Right.
Do you have any other symptoms? But as of anything, our cultural mentality, I feel like, Kelly, is to be like, I do
Mm.
it all. I'm going to like throw myself into this and do it all. And there is a lot of overuse of pelvic floor strengthening, I think, out there generally.
We live in an era, a time where our stress are obscenely high.
Very tight.
What you're saying, I'm going to say we're all walking around with very tight pelvises, really,
Yeah,
right?
that's why. I mean, there's movies literally based on like Tightly Wound that are like based on this.
Yeah.
And when you think about when you go to a yoga class and the yoga instructor's like, drop your shoulders away from your ears and relax your jaw, you subconsciously like, I didn't even know my shoulders were up in my
Oh,
earlobes, but they are.
absolutely. Yes.
And the same, I would challenge you and your listeners to say, like, okay, right now, sitting here, are you squeezing your glutes? Are you clenching your abs? Are you clenching your butt muscles or your inner thigh muscles? All of those things will then contribute to clenching or gripping at your pelvic floor. That creates more opportunities for tension
Mm.
over, like being too tight, over tight, which can contribute to all sorts of stuff like pelvic pain or pain with intercourse or penetration or pain with orgasm, etc.
And it's polar opposite. And we've talked about this idea where we're supposed to be tight for, that's sexy and that's better for your partner. And
Cringe.
meanwhile, the reality is that's not better for your sex.
It's not about the tension, it's about your ability to contract and relax.
Yeah.
And so tension may create more pleasure for one person, but experiencing that is not going to be bilateral in pleasure a lot of times versus if you can contract and relax, then that relaxation, we as females, we take 2 to 3 times longer to physiologically get aroused, get lubricated than a cis male. And so if that happens, then the vagina is in if I'm talking in relationship to heteronormative relationship.
Right. Absolutely.
Prepare for penetration. The vagina physiologically, as you are aroused, elongates to accommodate.
Wow.
And I know it's fascinating.
I mean, it's kind of amazing. We're always accommodating.
Girl, you just nailed it.
It's just
So in order to be able to do that, you have to be able to relax all the way. Like relax, like, hey, chill, girl. I mean, like your muscles can't be spasmed or hypertonic.
well, and I think, and you're thinking about sex and intimacy and a time where you're trying to connect, whether it's to yourself or with a partner, not being so tense. Your body's telling you, right? And if that sex isn't comfortable and not able to connect with your partner or even with yourself, that's something I would want to explore. It doesn't have to be that way. And I think that's the hard part is there is sometimes a belief that it's fine, just get through it. It doesn't have to feel good, just get it done. And that's a loss.
I agree with you. And I think this is one of the reasons why women's health specialists and pelvic floor PTs and pelvic health specialists collaborate so often with mental health care practitioners
Absolutely.
because there are a few things I want to like strike a line through, and one of them is that it's okay or normal to experience pain with sex. No, it is not. It is common, but it's very treatable and it's not normal. The other thing I want to strike a line through is that uh, people with a vagina don't typically orgasm with penetrative sex. It's not necessarily true either.
Yeah.
You can get there. But also it's okay if you can't. You can use external stimulation. There's a lot of different ways, and so kind of just powering through that when you're pushing yourself through something, and you know this so much better as a mental health practitioner, you know, you're like kind of getting that task done that kind of doesn't fulfill those intimate closeness needs.
Yes.
Some people look at it as like fulfilling that for their partner, and everyone is different.
Yeah.
But what I look at is sex is really great for your physiology. You're getting blood flow to the area,
Yes.
lubrication to the area. You're basically exercising those muscles. It's giving you this ding of happy hormones.
Yeah.
It's increasing your heart rate. It's like aerobic exercise. It's that like connection. So there are a lot of benefits to it. And on the reverse side, if you're having sex in any way, or touch,
Yeah.
pleasure, and it's painful or uncomfortable, then that sends this message to your brain that like, oh, this act is uncomfortable, and which makes your body want to clench and tighten up more, and then it kind of
Absolutely.
becomes this feed forward system.
Yeah. And then you emotionally detach from it, right? You're like, I don't want to do this. This is not something I want to be part of.
Very similar to experiencing, you know, for folks that have experienced a sexual experience without their consent. And so, like,
Right.
when they go to have a physical exam, even though it's a doctor and they've consented to it, they're without even their, you know, subconsciously, their muscles are kind of clenching.
There is opportunity and possibility. It doesn't have to be that aspect of yourself shut down. I think as we hit this stage, a lot of women unfortunately get into that thinking. So we spend a lot of time on sex, which is always good.
Now I kind of like, I want to talk about like, okay, so sex is painful or uncomfortable as
Yes.
you go through perimenopause. Like, what do you
Yeah.
do about it? And
Yeah.
I think the answers there are, you know, there's a lot of really great vaginal lubricants that are either coconut oil or hyaluronic acid based out there. There's using toys for pleasure. It's experimenting with different forms of intimacy and knowing just like how at 45 or 50 you're not working out in a gym the same as when you were 25, that
Yes.
it's okay that sex changes. It's okay that you want more oral sex or changing in positions or things like or you know, and so there's a lot of things that you can do to help your vulva move along with you on this adventure.
Right. And it doesn't have to be an ending. Right.
No.
And
In
that's,
fact, I think it can be a great beginning.
I
Kids are
agree.
leaving the house, you know, unless we like, you know, we're older when you had a child like you and I, but um, then it's just indefinite. But it's like there's a little bit more free time. You feel really empowered in your body. You
Yes.
know who you are. You can
Yes.
vocalize what you want and what feels good to you. There's so many more resources out there. I mean, you can buy a vibrator like Anthropology or Free People now. Like,
Oh, no.
and that's
So
very
different.
different than it was 10 or 15 years
Yeah,
ago. Great books out there that you can give as resources to your partner to help like explore this. So I think it's more of an opportunity for a new opening versus a closing of a door.
absolutely. And I do want to say one thing I so appreciate about your field and pelvic floor therapist is I found you guys do such a wonderful job, you especially, in really being aware of trauma and being clued into where those areas of tension and fear can come out most when we're talking about sex, most when we're talking about the most intimate places in our body. And I just want to acknowledge that as a mental health clinician, I think you guys really align, and I appreciate that because it makes a difference. It helps it referral wise. It makes you feel confident that it's a safe place. That knowledge, because it is an intimate time and it can feel uncomfortable, but you guys you've done an always a great job in being there for clients in that respect.
Thank you. There's a lot of training for people that are experienced pelvic floor PTs and have gone through a lot of rigorous training
Yeah.
in trauma awareness and a lot of informed consent in treatment of folks when we're talking about gender identity that's very trauma informed and gender identity informed. There's all of these different things that kind of package together that really help us create a safe atmosphere for somebody when they're doing something like internal pelvic. For the record, we don't use speculum or stirrups. And so it's a much different experience.
Yeah.
But that's also to say that like um, pelvic floor therapists are great referrers. Like we know that we have a scope of practice. We can talk about the central nervous system and the parasympathetic nervous system and how, there's these theories around pain and neurologically how that works.
Yeah.
But we never want to open Pandora's box for somebody in an emotional level and say, okay, well, now go home. And we almost always partner with therapists, mental health therapists, to guide clients that need a little extra help on their way.
Yeah, absolutely. And I just really appreciate
Yeah,
that.
it's all about the team.
It is.
I think I
I
think
just,
clients appreciate it too. Like
right?
we're all old enough to say, like, yeah, I need a few people on my team right now.
Speaking of teams, if you could put together, because it's perimenopause is not a solo sport, right? I mean, it is hard to
No,
do this and work this out by yourself.
it's not cheap either. I
But
think
no, gosh, they don't tell you this, huh?
no.
What what would be on a woman's support team? Like if you were putting together an ideal team as a woman's going through, who's got it, who's on her docket? Who's like,
I mean, I guess it depends on different hypotheticals. Are we living on a commune with baby goats? Because that might be a little bit better to choose. No, I think in the real world, um, you want to find an like OBGYNs are really incredible resources.
yes.
And often people starting their career doing a lot of OB and delivery, and as they progress through their career, they move towards less of that and they want more balance and a little bit more office time and less of the overnights. But there are a lot of people moving now into subspecialty, and there is a lot more push in practice advocacy for OBGYNs to have a higher level of clinical knowledge of perimenopause and menopause.
Yeah.
And so, where it used to be that you would like ask your OBGYN or GYN to do like hormone testing, and then they would send you to an endocrinologist. I think there's a lot more awareness now. So, finding a GYN, which I'm not saying is easy, we all know there's a GYN shortage nationwide. It's not going to get better.
That is the truth.
And sometimes it involves a lot of wait lists. But we know perimenopause is coming. And so finding somebody that you're like in the back of your mind when you're 38 or 42 that you're like, you know what? I think I want to transition to this person pretty soon because I'm going to start feeling stuff and I want to go to this person is a good idea. I really love acupuncturists for perimenopause and
Oh, I
menopause.
like that. Yes. Okay.
Yep. I can't explain it from a medical perspective, but the hot flashes, the night sweats, some of the brain fog and really just being forced into an hour of self-reflection and meditation.
Yeah.
I I would say I would add to that you want somebody on your team that is kind of a generalist that's thinking about like your bone health, your blood work, your general baseline things that you want to look for,
Yeah.
as well as what's your activity? Like is it your Pilates instructor? Is it your running coach? Is it your running partner? Is it, like there should be a little house there on your team for some kind of physical movement, because as we know, when you age and
Mm,
start going through hormone depletion, uh, bone density changes, ability to build muscle mass changes, and the type of exercise you should be doing really changes into a heavier strength training, as is evidence based that we should be doing. So I think those are great members of the team.
okay.
And I look at perimenopause as a great opportunity to start pressing some of those easy buttons,
Ooh.
like you like if you're going to have brain fog and you're going to feel more fatigued, or you want to prioritize different things like having meal delivery 2 days a week, or have like different
Right.
different things that make people's lives, um, just give them a little boost and help them out. I also think nutrition, or there's like this house for like nutrition or functional medicine or naturopathy, something that's like evidence based and can provide you with an understanding as your body's changing and estrogen changes how your weight is distributed, what your fatigue levels are, things like that. And then the biggest member of your team is yourself, because you know what your body was like before, and you
Yeah.
can be the first to identify changes. And the as we see, women are having babies later and later in life.
Hmm.
And so many of my clients are coming to me postpartum between the ages of 36 and 43, whereas 15 years ago that looked different.
Right.
And so there are a lot of people that are a year or 2 years postpartum, and they're like, I'm experiencing brain fog and night sweats. And people are like, well, you're postpartum. And I think knowing your body and being an advocate for yourself, you can say, yes, I'm postpartum, but could I also be perimenopausal? And what are the next steps for that?
And I think that happens so much, that
Yeah,
piece,
happening.
right? Where
And I was like,
you're
I'm
not
the expert. You gotta I know something's happening. And
alone.
and and then the other thing is that when you tell folks that, well, perimenopause can last for like 10 years, people are, no. And
Yeah.
I use it as an opportunity, like, okay, we've like dealt with like kids in pre-K and kindergarten or busy careers, and like are like, now's the time to get your SHIT together and say, like, do you have a dermatologist started getting an annual skin check, because
Yes.
hormones affect that so much. Same
Absolutely.
with dentistry.
Yes.
Like,
Your
women's heart
arteries.
health is so important. It's so
Yeah.
critical. The other thing, I have a family member who's an audiologist, and I've always been like,
Love
every
it.
woman should get their hearing tested as they're going through perimenopause,
Yes.
because hearing has such a strong connection to cognition and socialization and dementia, as a whole host of other things. So having a baseline, because most women don't know that they have hearing loss until it's more significant and they're already experiencing all of these symptoms.
Yes.
I think audiology is a great add to the team that's often not thought about.
I love that you say that, because, and I think when we've talked about it in the past, it's also balance, right? Like all of a sudden, you probably see it, your clients falling. Is that an equilibrium issue, right?
Yep.
And it's huge.
And it's huge. I, and just like, I think adding on your team is a pelvic floor physical therapist.
I was gonna say.
They're a little self promotion here for our field, and a mental health therapist.
Yes.
you know, and when you're a lot of people choose or like seek out a pelvic floor PT when they're actually experiencing leaking or symptoms of pelvic organ prolapse or things like that. Whereas my argument is that when you're going through these physiologic changes, like maybe in your 20s, you're more sexually active, like, you're not planning on getting pregnant for a while, but like, do I know my body? Do I really understand it? Like, what am I
Right.
supposed to be doing? You're thinking about getting pregnant. There's another phase. You're pregnant or postpartum. I think perimenopause is something else that like just popping in and being like, like, can we check things out? Like, how often should I really be strengthening my pelvic floor? Or,
Okay.
what should I be thinking of? Like, who knew constipation was related to the pelvic floor? And like, this is how, we should do things. Or I can't use a cup comfortably. What do you think about X, Y, and Z? I think there's a lot that very simple little tweaks of
Okay.
change and body awareness can help to say like, let's break this intergenerational trauma, I'm going to
Yeah.
call it. I'm going
Yeah.
to be a
Yeah.
wide swept word here for
Yes.
therapeutics of wearing panty liners in our older age
Right.
indefinitely. I
Right.
would
Right.
like to stop that for
Yes.
our generation and beyond,
Yes.
that we can do a lot to make sure that doesn't happen.
We go for your yearly dermatology appointment and your annual with your gynecologist and your physical with your doctor. And I hadn't thought about, do you do a yearly PT, like your pelvic floor, and just kind of check out, hey, how are we doing down there? Like,
Yeah.
what's going on? Is that something?
Yeah, or like I took up running because I was noticing that I was gaining more weight because
Right.
I'm in perimenopause. And then you can come see me and I'd be like, yeah, that's a great idea. But what if we added like this? Or what if we added some more deep strength training or Pilates? Okay, let's check your pelvic floor. You got a little bit of weakness and you're not leaking or anything yet, but like maybe we add a little bit of strengthening in. I think there's a lot of things, or I can even say your tissues feel a little thin or they feel a little dry. Like, how about we talk about what's next for that?
Okay.
And collaborate with your team. Do you need to come every year? Probably not. We
Okay.
got enough stuff to do. But I think that every couple years or like touching base and having somebody that you know that you trust and kind of saying like, instead of waiting until you
Right.
move your kids into college and then you're lifting heavy things and suddenly you're feeling a falling out feeling in your vaginal area and panicking, kind of starting ahead and kind of, you know, I understand there's logistic and financial and time
Right.
wise, like all of these different folks on the team, like we'd have to take a week off and be in doctor's appointments. You got mammograms, colonoscopies, like all this stuff.
Oh, yes.
But I can tell you, we've only got one body,
Yes.
and taking care of it at 40 or 50 is a heck of a lot easier than trying to take care of it at 70.
Absolutely. Such a good point, because it's hard to mentally go there, but it's so necessary. When I hear the crispies in my joints, I'm like, "Oh, I got to be moving, right? Like I got to."
Lotion for that, crepitus as we call it. It's not an indicator that anything's really wrong, but yeah, like
Yeah.
and that's another thing is most people don't realize the connection of estrogen to joint pain because
Yeah.
estrogen helps so much with joint lubrication and the fluid in that capsule around your joints. Um, you know, there's I mean, dry eyes, like
Oh yeah.
so many things that hormones contribute to on a cellular level all over our body. It's not just about the pelvis.
No, that's the part that's just so eye-opening that I love about this work. You've opened my eyes in general, just knowing you all about the pelvic floor. I'm like, oh my gosh.
And this is just perimenopause. I mean, you could go on and on, but I think it's really interesting, and I also love that it's it's really gaining leverage
Absolutely.
from many different outlets to do more research, to have more awareness, to a greater understanding. Now, with that, that's coupled and goes hand in hand with a lot more people are discussing it or talking about it, and we need to all, as consumers of information, recognize that influencer does not necessarily mean
An
expert.
expert or trainer?
Um, I have a lot of people that come to me and they're like, I saw on TikTok that I should or should not be doing this. And I'm like, okay, well, that's not my expert opinion, but let's talk that through. Um,
Absolutely.
yeah.
And it pays off to do your research and to consult. And I love the idea of if things are shifting or you're doing the sneeze pee and you're like, oh, wait, this doesn't have to be
Oh
like this,
no.
right?
I'm
We
like,
can actually fix this.
you sneeze pee once, you call me.
I
Like,
love that.
yeah,
Yes.
no, like that's not okay. If I had foot drop once or twice, you'd be like, panic. Like, I gotta go. Like, but like, and that's like your foot. But when we're talking about like the space that holds like many of your reproductive bowel and bladder organs, like in and has all of these multiple functions, we're like, little weakness. Can wait another 20 years. What
I,
is that? It's
I,
uncool.
I,
No.
I feel like after my first child, it was no big deal. And then my second, I was like, oh, okay, this is actually not okay. And I think it's good that this conversation continues because we don't have to live, to your point, with forever panty liners or sneeze peas. It doesn't
No.
have to be that way.
No. Or like plotting out on your 3 hour drive the 17 different stops at Starbucks you're going to make so that you can use the bathroom. Like, there's so many parts that go into this. And I think it's just about, instead of looking at perimenopause as this change that causes deficits or this sign of like aging,
Right.
I would look at it as an opportunity to do a really good refresh of how you want your body to feel and how you want to carry it with you for the next 40 years.
I say that to all my clients. I'm like, come to therapy when you're not in the storm.
Yes.
We'll prepare you for that storm.
Yeah.
It's
It's like
really fun.
mental and vaginal resilience.
Yeah. Yeah, absolutely. I so appreciate your time. And I have one final question I
Okay.
always like to ask
Hold on.
is if you could put on a post-it on every woman's mirror as she enters perimenopause, what would it say?
It's so hard. I'd have a lot of
Why
post-its.
not? Just one that top of mind.
Um, I think a friend said to me the other night, she was like, that's not yours, that's theirs.
Oh, I like
And
that.
that's something that I've really sat with.
Okay.
I know there's like, the whole let them theory and there's some controversy surrounding that, but I think this is a little bit different of like, it's not that you're like telling them they should or shouldn't do it or anything. You're just like, I got enough. Like that's theirs to manage. That's their appointment to make. That's theirs in so many different ways. And that really helps you reflect on like, well, what's mine?
Mm, that's beautiful. I
Also,
love that.
like anyone who is going through perimenopause right now definitely danced to a bar 20 years ago to Lil Jon's Get Low. And so like maybe my second post it would say get low. And then I'd be like, you know what? Someone's cutting me off in their car, get low. Like,
I love it.
it's like, no, like I'm in perimenopause. Don't test me. I'm gonna get low. Like,
I
so,
love it. I will say those are some great post-its. I see them. I think I might put them on my mirror.
you know what? I'm gonna go home and do the same thing. And then of course, every time like you're like in a bad mood or in this funk, and then you like go in the bathroom and you see get low, and you're like,
Yeah. Oh my gosh. Well, this has been a true treat. Thank you so much
thank
for
you so
joining.
much for having me, Callie.
All right. Thanks.